mentioned a couple of times our subject, and that's going to be footwear, and especially with summer in mind, because that's the time when people are outside a lot and you put on flip-flops, you just slide into those, or a pair of sandals, and you may not wear those the rest of the year, and we'll see what that might mean as far as your foot comfort is concerned. Our guest is from University of Missouri Healthcare, and he's a podiatrist from there and also an assistant. I want to get this right, sir. I know that you also assistant professor of orthopedic surgery. Is that right?
That is correct.
Pleasure to meet Dr. Kyle Fiala, who is here to talk about this. We're talking off the air, and I mentioned this, I think, maybe in my promo for this segment when I put it together yesterday. My wife on Sunday night, she said, "Oh, my feet hurt." She said, "I think I was in my sandals too long." What do you see, or what do you get as a doctor when you're answering complaints or hear people talking about their feet?
Yeah, the overwhelming majority of patients that come in that have foot pain, I think a lot of it is tied to they just have kind of worn the wrong pair of shoes. I always say moderation is the key. It's perfectly normal and fine to wear flip-flops, but you don't want to do that all day, every day, or especially if you're going to be really, really active. That may be a better time to wear a more supportive shoe, like tennis shoe or a walking shoe.
People wear these year-round. I mean, we're talking about summer, but I see people in flip-flops and in really just flat. It looks to me like there's hardly anything. I've had to do double takes sometimes to try to figure out whether that person was even wearing anything on his or her feet.
That is correct. Yeah, there are a lot of, not all flip-flops are created equal. And so there are some better options out there. What I would say is, and I tell patients to, you want to have a flip-flop or a sandal that has the thickest amount of sole or a thicker sole. The more straps, the better. The more straps you have, it's going to be more supportive. And again, you just don't want to wear those all the time.
Do you like seeing the straps that would come behind the heel as well as across the front part of the foot?
I do, yeah. That's going to give a little bit more support than just, kind of a regular thong, flip-flop that has no back to it.
So when you are walking and you're using that, see, I don't wear those kinds of shoes enough, but every time I slip on something that would be like a flip-flop or something that didn't have any kind of way to keep the shoe on my foot on the back, I find it really hard to walk in those. I guess it's kind of a art form that you'll learn over time. But to me, I think that puts a different kind of stress on your foot.
Yeah, it absolutely does. I mean, it definitely changes the mechanics of how you walk. Typically you kind of pronate or you rotate your feet in more. And that's good. I mean, that's what our foot's designed to do. But if you're in that position for too long, that becomes kind of loose, becomes unstable in the foot, and that can lead to a lot of injuries and things that we see.
What do you say to those who would say, look, we started out barefoot. I mean, didn't have shoes way, way, way back. Wouldn't it be better just to go as natural as you can?
Yeah, I mean, we do hear that a little bit, and I think it's kind of an interesting point. Technology is good, right?
There's a reason we created shoes.
There is.
Those flip-flops that are like maybe not quite a half inch, but sometimes about a half an inch, and they're rubber. Do those conform to your foot well?
Not really. I think there are better options out there.
Let's talk about some other options. You talk about straps, more straps, things that hold on to your heel. My daughter's a fan of Chacos and Birkenstocks and those kinds of shoes. What are your thoughts about those?
Yeah, I do like those. I do like Chacos. I do like Birkenstocks. I think those are really good shoe companies. They make a really good sandal. They're not for everybody. What works for one person doesn't necessarily work for the other, but those are good brands.
How do we figure out what works best for us? Is it trial and error?
Yeah, a lot of it's just trial and error, and it's kind of experimenting and finding kind of what works and what doesn't. And if you try one thing, and it wasn't comfortable, or it kind of led to you started having some foot issues or discomfort, maybe it should be a sign to look for something else.
I just think of foot pain basically more than anything else. But are there other things that happen, or calluses or blisters or bunions or whatever else happens? What other things should I broaden my awareness of?
Yeah, I mean, this time of year, it's warm, and kind of a good recommendation is we really don't want to go barefoot all that much. We always want to have something kind of on our foot, especially in kind of our diabetic patients. Diabetic patients oftentimes kind of lose some of the sensation or feeling in their feet, and so they could step on something, glass, thorns, needles, and that can really cause some issues. You can have infections, things like that, and especially and public places too. We want to kind of avoid going barefoot. Another thing that we commonly see, if we're doing any kind of yard work or any kind of manual labor outside, really probably would be a good idea to wear shoes. Every year we see a kind of a string of people that run over their foot with a lawnmower or hit their toes with the weed eater, and these can be really some bad injuries.
Do you ever cringe, or I should say, how often do you cringe when you see somebody riding a bicycle or riding a motorcycle and they don't have complete foot coverage?
Yeah, it's definitely a risk,
because your toes can get pretty stubbed pretty quickly, especially if you're pedaling and all of a sudden something. I really try to use protection on my feet when I'm biking. A couple of other questions in regard to other types of shoes. I've heard it said, as far as running shoes and workout type shoes, that they wear out after a while, and so you need to change them periodically. What is your best advice on that?
Yeah, I mean, it's just like anything else. They're like your tires on your car. There's going to have a mileage limit on that, and over time, if we're using them a lot, they're going to start to break down, and they're not going to give you as much support as they initially were. And so, a good rule of thumb is, if we're doing kind of moderate activity once a year, kind of replace those running shoes. Obviously, if we're doing more running, or we're on our feet more, then they're going to need to be changed more often, maybe every 6 months.
I got to tell you, though, I have a pair of shoes. I don't run a whole lot, but I've worn these shoes a lot, and they are so comfortable now. My wife says it's time to get a new pair, and I said, why? These babies feel really nice. And so it's hard to give up those once you feel, because I think shoes can, I'm exaggerating a little, but they do feel very comfortable, just like they are meant to be on your feet if they are doing well.
Yeah, absolutely. And in those cases, that's definitely fine to continue those. It's only just when patients start kind of having issues, foot pain, these things kind of come up. It's the simplest and easiest thing to do is kind of look at your shoes.
Do you have more trouble with people who have high arches or low arches or no arches?
Well, too much of a good thing is a bad thing sometimes, right? And so the kind of the old myth was, well, if I've got a really high arch foot, I'm really good. But that can lead to other hosts of problems. Patients with a high arch foot tend to kind of walk more on the outside part of their foot, and the foot's a little bit more rigid, more stiff. And so that kind of creates a whole other set of issues. Opposite is true for patients that have a really flat foot. It's oftentimes it's really, really flexible. It's just not very supportive, and that can lead to a whole bunch of other things too. So, it's you kind of want that nice balance, be right in kind of the middle.
So what have we missed today when we're talking about especially summer foot care? What do people need to be aware of?
What I would say is, again, moderation, right?
And you're talking about moderation of going barefoot or moderation of wearing sandals or flip-flops that don't have much support traditionally.
Absolutely. Avoiding kind of going barefoot if we can, especially in public places, and if we're diabetic. If we're doing any kind of yard work, manual labor, riding a bicycle, motorcycle, make sure we have some type of shoe on. And just check our feet every once in a while. Sometimes it's good to look down there, say hi, make sure nothing's going on. And if there is, let somebody know about it. Let your doctor know, or, come see us.
Yeah. Athlete's foot, anything like that, other types of stuff. Does that bother you, or are you worried much about that?
We don't see a ton of it.
Yeah.
But, what I would say to that is, making sure our feet kind of get air, let them air out a little bit, not always having them in shoes all the time. If we do have, let's say, our feet sweat a little bit more, changing our socks periodically a little bit more. And then there's a lot of really good over-the-counter antifungal treatments if that does happen.
Pretty good. Doctor, thank you. I appreciate you coming in today. That's good advice, because I think we take, like you said, we maybe don't acquaint ourselves with our feet quite a bit. We take them for granted sometimes.
Absolutely.
Unless they start to flare up and hurt. Yep. And then it's like, what's going on? Dr. Kyle Fiala, who's been our guest from MU Healthcare, and he is a podiatrist there, and also teaches in the teach in the med school, right?
Correct. Yeah, the Department of Orthopedic Surgery.
Thank you very much.
Yep. Thanks, David.
It's News Talk 1400 KFRU.